Environ Life Science Limited, partnering for life.
Hello friends, are you worried about knee pain and are you worried about the treatment options for knee pain? Then this video is for you. Please watch it till the end. Hello everyone, I am Dr. Vikram from Kamakshi Hospital, JP Nagar, Mysore. I am consultant orthopedic surgeon. I am specialized in joint replacement and robotic joint replacement. I also have done a fellowship in arthroscopic joint surgeries. Today we will talk about osteoarthritis of the knee. First of all, what is osteoarthritis? So this osteoarthritis is a degenerative condition. It's also called as wear and tear of the knee. So in this osteoarthritis, there is wear and tear of the articular cartilage. So this part is the articular cartilage. This is worn out. As this articular cartilage is worn out, the bones start to rub against each other every time you move the knee. Because of this, there is some amount of stiffness, pain, and restriction in movements. Now, what are the causes of osteoarthritis? Osteoarthritis, as such, is a degenerative condition. So, age 60 and above are more prone to develop arthritis. Number 2 is overweight, obesity. More your body weight, more is the stress on the knee. Number 3 is fracture. If you had any fracture around the knee, you are more prone to develop arthritis. Number 4 is ligament injuries. There are some ligaments in your knee. If you have a ligament injury, you are also prone to develop this osteoarthritis. Number 5 is high demand physical stress. If you are an athlete with undue stress on your knee, you are prone to develop arthritis. Now let's see what are the symptoms of osteoarthritis. The patient to start with will have difficulty in getting up from chair after standing for a long time. He will have difficulty in climbing stairs. Later, as the disease progresses, the patient develops difficulty in walking. Then he also develops rest pain, some swelling, difficulty in knee movements, which we call as stiffness, and deformity of the knee. We see that the knees are deformed, they are bent, and some amount of instability in the knee. Patient tend to have some instability, as the patient might feel that he might fall down and might lead to a fracture. So these are the common symptoms of osteoarthritis. Now let us see the management part. What is the treatment for osteoarthritis? First and foremost is the lifestyle modifications. What are the lifestyle modifications that you have to do? Avoid stair climbing. Avoid sitting on the floor cross-legged. Avoid squatting. Avoid using Indian toilet. Please use Western toilet. All these precautions decrease the amount of pressure in the knee and hence will help you to avoid the knee pain related to osteoarthritis. Along with this lifestyle changes, you need to have a regular exercise pattern, a regular walk. Avoid running, jogging. It also causes pressure on your knee. You can do walk, you can do swimming, okay? You can do cycling. Next is weight reduction, obesity control. So diet modification is very important. As you reduce your weight, the amount of pressure that is pumped into your knee is reduced. So it also helps. Number 3 is physiotherapy. There are certain exercises that you have to do to strengthen the muscles around your knee. Okay, so once you strengthen the muscles around your knee, naturally it will help in improving your range of movements. So my colleague will now demonstrate you and teach you the exercises.
Press the rolled towel under the knees for 5 seconds and then relax. Repeat 10 times. Press the rolled towel under the heel for 5 seconds and then relax. Repeat 10 times. Bend your non-injured leg and lift the straight leg 45 degree. Hold for 5 seconds, then repeat 10 times. Lying down on your side with the unaffected knee, then bend it. Slowly lift your straight leg about 45 degree. Repeat 10 times. lie on your back, bend your both knees and keep one pillow between the knees. Then squeeze the pillow with your knees. Hold for 10 seconds. Repeat 10 times. Sit on your bedside with your back straight. Then straight your affected knee as far as possible and hold for 5 to 10 seconds. Then relax. Repeat 10 times.
Now let us talk about other treatment options for osteoarthritis of the knee. Number one is anti-inflammatory medications. Local word uses painkillers. This will help reduce your inflammation and pain to some extent. It's given as over-the-counter drugs. But beware, long-term use of over-the-counter painkillers will lead to renal damage. So please take the help of your doctor. Number two is physiotherapy treatment. There are some machine treatments available in physiotherapy, IFT, TENS, ultrasound, rushing current, which will help easing your muscles and your pain. Third option is intra-articular injections. We give some injections into your knee that will help in reducing the pain and inflammation. There are three types of intra-articular injections that we give. Number one is hyaluronic acid. We call it as viscose supplement, which will help in supplementing the synovial fluid in your joint. Number two is a PRP injection, in which we draw blood from your own body, process it and inject it into your knee. It is called platelet-rich plasma. It has a lot of growth factors and has good healing potential. Number three is a steroid injection. It is only given if there is too much of inflammation in your knee. Next option is surgery. In surgery, if the patient is a high demand, who is an athlete and who needs a lot of physical activity, then there are certain other options also available for surgery. Number one is a proximal fibular osteotomy, wherein we cut some amount of bone from the fibula. This changes the alignment of the knee on the left. So the weight bearing pattern shifts to lateral side. As a result, pain reduces. Number two is high tibial osteotomy, also called as HTO. Here we cut some amount of bone on the medial side and we put a plate. This surgery is basically to correct the alignment of the limb in a deformed leg. So this also changes the pressure pattern on your knee and hence brings some amount of pain relief. Ultimately, as the disease progresses and arthritis progresses to the next stage, the patient lands up into total knee replacement. Now what is total knee replacement? Total knee replacement is a surgery wherein we replace this part of the bone in the femur and this part of bone in the tibia. So whatever is worn out in the femur is removed and we put a metal implant here. So another metal implant is put here and this part of the patella, we sometimes do this patella replacement also. So after this knee replacement, naturally this movement increases and the pain-free movement develops. So there is a gradual physiotherapy that we do which helps in early recovery. Some patients are very hesitant about knee replacements, so you don't have to be worried and you are in safe hands. I wish you all the best. Thank you.